Hello, it's Dr. Gay from First Look MRI, and this is a 35-year-old female who twisted her ankle about 5 days ago, has some pain and swelling, and on this view we see some anatomy on the side view of the ankle. This is the tibia, the big bone that comes down the leg and it ends at the ankle. The tibia articulates with this bone called the talus. The talus has this dome along the top, we call it the talar dome. This is the ankle joint, and this is the calcaneus back here, the heel bone. And the Achilles tendon comes down back over here to the bottom, to the back of the calcaneus. Got plantar fascia down here, so now we're all oriented. And on this view, we see that there's trouble in two places. Number one, there's white here in the ankle joint. There's a little bit of fluid. Fluid is white. There's also white in the back of this bone. This is the tibia. It comes down. And you can see that marrow, like in the calcaneus, is uniform dark. And the talus is uniform dark, but right here is not. It's bright. So this is bright, almost like fluid. So this is a bone injury of the back of the tibia here. This is what we call a posterior malleolar fracture. There's a vertical black line here. Couldn't see it on the other one here. We just saw the edema or the injury of the bone, but here we can see that vertical black line. That's a non-displaced fracture of the posterior tibia. We call it a posterior malleolar fracture. Luckily there's no displacement, so hopefully this is going to heal. Now we're going to look at this from a different angle. Now in this view here, we're looking from the top down. As we come on down, we see back here the back of the tibia. This is where the fracture is. If we go one more cut here, we see there's a black line here. If we put up a different view, we'll see that a little bit better. This is called a T1 view, where fat is bright and marrow has a lot of fat. It's bright. So this bone is all bright. We're going to look up higher at that fracture. Here you can see a horizontal band right there. That's the non-displaced fracture of the posterior tibia, the posterior part of the ankle. There's one other finding here, which is over here. This is a ligament that is torn along the fibula and tibia. We call it the anterior tibiofibular ligament. If we come down lower, we see another ligament down here called the anterior talofibular ligament. This is the talus. Now we're going to come back up in just a second, but before we do, look at this in another view. So this is, again, the anterior talofibular ligament coming off the talus to the fibula. It's intact. You see that black line like a cable. This is the one that's almost always torn with the lateral ankle sprain. So this patient has this intact, which is unusual. But instead, if we go up, we see this one is torn. You can see the anterior tibiofibular ligament. This is the tibia, fibula. This one is torn. This is much more rare. And so the other ligaments on the lateral ankle here are intact, but this is a torn, ruptured anterior tibiofibular ligament with a fracture of the posterior malleolus non-displaced. There's a ligament back here called the posterior talofibular ligament that comes across and it attaches to this fracture fragment. So there was stress and it popped this, and here it didn't pop, it just didn't pop the ligament, instead it fractured the bone. Now if we go up higher, there's another ligament in here called the syndesmotic ligament or interosseous membrane, and this thing is important to hold the tibia and fibula together. And this is a view up higher where we see the tibia, fibula, and this ligament is up in this area and we just don't see it very well, so this is at least partially torn. When this ligament gets torn, we call it a high ankle sprain. That syndesmosis, or this broad ligament, gets injured. So there's a posterior malleolar fracture with a ligament injury up high here, a high ankle sprain. And that's it. Thank you so much.